Hi, my name is Michelle. I'm one of the ortho coordinators here at UnaSource Surgery Center. We'd like to talk to you a little bit about coming in for your joint replacement here with us. I have Jim and Allison, who are part of our physical therapy team here at UnaSource. We're going to talk to you a little bit about what to expect when you go home. And I just want to mention too that before surgery, you're going to spend a little bit of time with myself or one of my colleagues on the telephone, going through your history, going through instructions, giving you a chance to ask questions. We also have other resources on our website for you. There's a 10-minute video that we'd like you to watch preparing for your joint replacement at UnaSource. There's also a booklet we'd like you to look through. There's a lot of great information there that you can find. At this point, I'm going to turn over to Jim and Allison and let them give you some great information to help you through this process.
Hi, my name is Allison. I am part of your physical therapy team here at UnaSource. I'm going to talk to you a little bit about the day of surgery and what you should expect from our staff. When you are in surgery, myself or a member of our physical therapy team will meet with your caregiver in the lobby. We'll give them a packet of information that outlines ways on how to keep you safe and ways that you can have the best recovery possible. Once you come out of surgery, myself, again, or a member of my team, will be present with your nursing staff so that we can help manage your post-operative pain. You will have some degree of post-operative pain, but it will feel better when you stand up. Once you're dressed, we'll stand and walk. We'll walk down the hallway, we'll walk to the bathroom, we'll practice transfers in the bathroom with your caregiver so that they know that you're safe at home. Then we will walk towards the stairs. You'll perform some stairs before we get you safely in the car. Once you're in the car, we'll make sure that your caregiver is confident with the instructions they've been given.
Hi, I'm Jim. I'm another member of the physical therapy team. I'm here to talk to you about your post-op recovery after you leave the surgery center. Our number one focus is to keep your pain level anywhere from a 0 to a 5 out of 10 during your recovery. What a 5 out of 10 pain means is it hurts, but you still want to get up and walk. Anything above a 5, you tend to want to lay in bed and just rely on the pain medicine, and we don't want it to get to that point. Most patients will experience an increased level of discomfort a day or two after surgery, which is when the nerve block will wear off. But the pain medicine that the nurses will talk to you more about will help control that pain and keep it down to a level of 0 to 5. The second way to help with the pain is icing it. 6 to 7 times a day for about 20 to 30 minutes at a time. What we don't want to do is apply that ice directly to the skin. We want to make sure you have a barrier of some sort, whether it's clothing or a towel or a pillowcase. The third way to help with the pain is movement, getting up and walking and doing the exercises. So the day you go home from surgery, we want you just to relax. Get something to eat, take a nap. If you have to get up and walk and go to the bathroom, or you're tired of sitting and you want to get up and move, absolutely you can do that. Just don't set yourself up on any schedule. We want you to rest. We want you to get this anesthesia out of your system and get feeling better. The second day, when that medicine's out of your system, we do want you to get up and walk every hour when you're awake. Don't worry about how far or how long you walk. We just want you to move. As you become tired or sore, take a break. We don't care what you did the hour before. We don't care what you do next hour. It's the consistency of getting up and moving that's going to promote healing and help with pain relief. A few things with that is, one, when you do get up and go for your every hour walk, stop at the bathroom. And you'll see the day of surgery when you get up and move, it's a little bit slower process than you're used to when you're moving. And if that bathroom is far away, it's a race to get there and we don't want you to fall. So being proactive with it will help keep you safe. The second thing is you're going to go home with this gait belt on. It's very important that you have a caregiver that's going to be with you for the first 48 hours. So if your surgery's on a Monday through Wednesday, anytime you get up to walk, your caregiver is holding onto this belt. Anytime you're going to put your feet on the floor to stand, somebody is with you. That's how important this is. We do not want you to fall and we want to keep you safe. The highest risk of falls are the first 48 hours. You're going to be taking that oral pain medicine, which can sometimes make you a little lightheaded or dizzy. So having somebody with you to make sure you're safe is important. We're also going to have you go home with a brace on, this immobilizer, and you're going to wear this immobilizer for the first 24 hours. So any standing activity that you do in the first 24 hours, this brace is on no matter what. Anytime you're resting, laying in bed, sitting in a chair, couch, recliner, we take this off and we put these SCDs on. These are called sequential compression devices, and these help reduce the chance of getting blood clots. So anytime you're resting, These will be on and you'll use these for 2 weeks. We will show you and your caregiver the day of surgery how to put these on. So you may also go home with some restrictions or precautions with your hip replacement. We'll know more the day of surgery from your surgeon and the type of surgery that you have, of what precautions, but we'll review that with you and your caregiver before you leave the center. As far as physical therapy goes, you're going to receive about 1 to 2 visits of home care following your hip replacement. You'll follow the exercises that your therapist tells you, and then when you have your follow-up appointment with the surgeon, they'll decide at that time whether or not outpatient physical therapy is needed. But truly, if you're consistent with your exercises and you're consistent with getting up and walking, that might just be enough to keep you out of physical therapy and keep you moving in the right direction. And if you do all this, you'll be on the road to recovery.
Thanks for taking the time to watch this video. We hope you found this information useful. We'll see you soon here at UnaSource.